My talk is on ACL repair. Basically, it's a remnant preservation. So as an orthopedic surgeon, we all know that to replace a tissue, same type of tissue are the best. So skin replaces skin, muscle, and then no one knows better than orthopedic surgeon, the bones are better replaced by the bones. But when it comes to the ligament, it is replaced by tendons, say it is a BPTB, hamstring or quadriceps. So ligaments are replaced by the tendons. Because we don't have ligament with us, there is no donor ligament, that is the reason we have to resort to the other structures like tendon. The concept of this presentation is, if you cannot replace, why not to preserve the ligament which is already there? Why to sacrifice that? And that brought the concept of the remnant preservation, and the extreme of remnant preservation is the ACL repair. There are several advantages of remnant or ACL repair. Number one, it is a ligament. So probably the whole 18 months of ligamentization process will be not required for a ligament because it will remain a ligament. And the most important, I presume, is the vascularity. This is a very important paper which is just published from India itself, from PGI Pondicherry, which shows that what happens in the ACL remnant in different times. So they have compared in 2 to 5 months, 6 to 8 months, and 9 to 20 months. When a patient undergoes surgery, they took a biopsy, and what they found that the amount of vessels and the caliber vessels are plenty in these remnants even after 9 to 20 months of injury. So your remnant remains vascular for a very stretch of time, and then this paper clearly says that in 2 to 5 months duration the vascularity is extremely awesome, and then you see the number per square millimeter is extremely high. That says that your remnants are very much vascular. You see, there are other several advantages also. I'll not go into that, but what is important is remnant is present in all the cases of ACL tear, irrespective of how late it is, how late the presentation is. The size of the remnant, the quality of the remnant may differ, but they are present. So how to deal with these remnants is a challenging question, either to repair or augment, or you preserve the remnant. And there are several classifications that has described. Most probably we use Sherman classification to identify what to do. So will repair work? So if you go to literature, you will find out two group of paper. One is outcome of ACL repair, and the other group of papers are the outcome of ACL remnant, remnant preservation. So where are we standing in 2025? This is one of the oldest paper I have quoted here because this was published in 2019. It is a systematic review, and which says that probably ACL repair doesn't have that good result. The ACL reconstruction should be the primary attempt. But if you carefully look into this paper, you'll find out that this paper includes old papers, around 30 papers from 2005 to 2018 only. And this is 2017-18 when we started exploring the remnant preservation, repair. So these were quite older paper, and naturally it reported like that. But looking at the recent paper, this is a paper from our friend Dr. Vikram Maskar, who said that probably ACL repair in ideally identified cases, Sherman type 1, they have a good outcome. And to support that, this is the paper, systematic report and the meta-analysis, which says that ACL repair had a higher failure rate compared to ACL reconstruction. However, ACL repair showed better hamstring strength and Kuss symptom score, and no significant difference were seen in other PROMs, time to return to sports or quadriceps strength. So ACL repair is still evolving, its techniques are still evolving, but now we started getting paper which says that it has good result. What about the remnant preservation? Paper from 2023, they say that this was again overview of a systematic reviews. Compared with the standard technique, remnant preservation in anterior cruciate ligament reconstruction has more advantage in restoring joint function, stability, proprioception, but the potential risk of overstuffing of the notch has to be taken care of. This is from AJSM from 2024 December, one of the very latest paper which says that remnant preservation ACL are primarily with hamstring autograft result in comparable clinical outcome scores and significantly improved knee stability relative to standard ACL reconstruction without remnant preservation, without increasing any complication. So remnant preservation, if it is done properly, probably doesn't have increased rate of complication. And this paper shows that the proprioception and the muscle strength are better when you have preserved the remnant. So to conclude, repair is extreme of remnant preservation. Remnant puts biology to our construct, say it is vascularity, say it is proprioception, whatever. So remnant puts biology to our construct. There are mixed results at this moment coming out of both repair and preservation. Improvement in arthroscopy technique and instruments will further improve the outcome. And what we are going to have 2025, I'm sure that repair and remnant preservation is going to be the trend in coming years. Thank you very much. Thank you.
Thank you, Dr. Joshi. Is there any question from the floor?